Hello people, in this video we want to look at general anatomy topic, lymphatic system. Okay, so something that we don't notice or we can't easily notice also. This is the lymphatic system. What you already know is, guys, that you know there is blood supply, right? And then there is venous drainage. So your artery will supply blood, oxygen, right? And then once you utilize all the nutrients, oxygen, etc., the blood will leave via the veins, right? This much you know, artery, vein. There is yet another thing that in your tissues, okay, we'll use purple for that. Basically, your tissues have something called as a lymphatic drainage. Lymphatic drainage, okay. So basically, what it will do is it will remove all the fluid, the tissue fluid. So it will absorb the tissue fluid. So that is what is called as lymphatic drainage. So you have a lot of lymphatic vessels. Okay, they are draining, right? So you can see they are draining here. Lymph nodes are there. And then there's lymphatic drainage that goes all the way here. And finally, there's a thoracic duct here that will join your, actually enter the superior vena cava. So superior vena cava is vein, right? So you can say it is finally going to join the venous system only, and this will drain into the right atrium, right? So look at this image here. You will see that the lymphatics, here they are showing you the lymphatic trunk, cisterna chyle, right? And this is the thoracic duct. The thoracic duct is going all the way and it is draining here between the subclavian and the jugular, right? So this is your thoracic duct. Looks like most of it is entering the thoracic duct only, but only on this side a small portion, the intercostal lymph vessels, etc. Only on this side, right side, slight thing is entering here. Here you don't have any thoracic duct. Thoracic duct is only on the left side. So did you understand, guys, as to what exactly the lymphatic system is? It is a drainage system. It is in accessory with the venous system. Venous system also will help some amount of drainage of the metabolites, carbon dioxide, etc. So basically this is a drainage system which is an accessory with the venous system, okay. So most of the tissue fluid formed at the arterial end of the capillaries is absorbed back into the blood by the venous end of the capillaries and post-capillary venules. The rest of the tissue fluid is absorbed by lymphatics, okay. So look at this image here. Go back here. This is the image that you need to understand. Here you have the artery, here you have the vein. So artery is bringing the blood, arteriole they are saying, these are the capillaries, and then exchange happens, everything happens. Then finally the deoxygenated blood with metabolites, etc., some things that are draining, they will all drain and it will all exit via the venules. Most of it. The rest of the fluid, tissue fluid, around 10%, 10 to 20% is actually absorbed by the lymphatics, which here they've shown in green actually. It should be purple, you can say. We use purple actually to represent lymphatics, isn't it? Okay, and it begins blindly in the tissue space. So these kind of begin here in the blindly. That's what they are saying. Look at this. They just begin blindly in the tissue space. Okay. So what they are saying is the venous system is actually of the fine drainage type. Okay, and the lymphatic is of a coarse drainage. C-O-A-R-S-E. Coarse drainage type. Okay, that's it. Now this is how it drains also they are showing. You can see here. This is that blind or how it will start, they said, right? See how it will, this image is not at all clear, but look at this. There is lymph here. There is tissue fluid which is entering, right? It's not clear. Leave it. Okay. So let's go back here. So basically it is a drainage system which is of coarse type. Okay. Which is in accessory with the venous system, which is a fine type of drainage. Coarse is because it can carry very large particles like proteins and particulate matter it can carry. Okay, that's why it is called as coarse. Okay, coarse type. Coarse type. Okay, coarse type is important. That's why they are saying larger particles. So did you understand? So this is large particles, proteins, particulate matter, etc. It will remove. Something about lymphatic system is kind of still a mystery for me itself. We can see an artery, we can see a vein, but actually lymphatics and all we don't see. The lymph nodes, only when they enlarge you can actually feel, kind of a thing. Okay. So now let us go to the components of lymphatic system. You have the lymph vessels. So what will these vessels have? They'll have lymph, isn't it? Lymph is actually another fluid in your body. Okay. It is clear and colorless. And from the small intestine, whatever lymph is coming, it will be milky white due to absorption of fat. Lymph from small intestine will be milky white due to absorption of fat. Okay. So basically, what else you should know? The the intestinal milky lymph is called chyle. Okay. This one, which is from the small intestine, that is called as chyle. Okay. Then let us look at this lymph vessels. We already told you that these vessels, they will begin blindly in the tissue space like this. The fluid will enter at this opening itself. It will act as valve. One way it will move into the lymphatics. So that is why what happens when lymphatics are blocked, right? There will be edema. There can be edema. So you know that filarial worm and all, they will attack the lymphatic filariasis. People will have that time. The worms will block all this. That time the person will have edema and elephantiasis, etc. Right? So many reasons are there for edema. So you should understand why edema happens. Let's explain why edema happens. See, there's an artery here, right? And there's a vein here, which is supposed to take out a lot of stuff. And there is lymph here. Okay. So the reasons for edema, that is this tissue having lot of fluid, is one is that there is more fluid coming from the artery, because the permeability is more, or the albumin level in the artery is less. So there is fluid coming into the tissue, or there is no proper drainage into these two. Okay. So that is when this could be blocked, etc. So that is when there will be edema. Okay. Edema. Look at the legs here. They are so edematous, right? Actually, this is non-pitting edema. It will not even go in if you press. So this is all caused because of this filarial worm, Wuchereria bancrofti. This is one of the causes of filariasis. Okay. So this is elephantiasis. It's called, like elephant legs, right? So this and all will block your lymphatics. So that's why you should understand that there is something called as lymph. Something called as lymph and lymphatics. Okay. So we are telling you here that there is something called as lymph capillaries. They begin blindly, right, in the tissue spaces. They begin blindly in tissue spaces, and the openings itself will act as valves. Okay. And they form intricate network. Fine. These capillaries are actually absent in brain, spinal cord, etc. In central nervous system, it's not there then. Not there in CNS, is it? Because they are saying lymph capillaries are absent from the cellular structures like brain, spinal cord, splenic pulp and bone marrow. Okay. Then, basically, for this lymphatic system, have you seen anything like a heart which pumps, etc.? No. So that is why these and all are low pressure systems. Okay. Not like your blood and all. There is no pump and pressure and all. So these are low pressure system, and they are wider than blood capillaries. This is what you have to remember. How is it different from blood capillaries? It is low pressure system, and it is wider than blood capillaries because it has to carry larger things, coarse drainage, right? Then, like you understand, this lymph is not a closed system. See what it will happen? This lymphatic, it will just take from everywhere. It will go and drain into the veins. That's it. But unlike blood, which keeps going in loop and loop and loop, this lymphatic is not a closed system. Okay, lymphatics is not a closed system. So let's write that here. It is not a closed system. Drains into veins. So it's not a closed system. Okay. So did you understand? Now let's move on. Where were we? Here. Okay. Now let us go to the next one. So the lymphatic capillaries will join to form lymphatics. Okay. So you have superficial and deep lymphatics that you leave. Then there are nodes, lymph nodes. In between here and there in this lymphatics, there are lymph nodes. These will trap. So any tuberculosis bacteria and all of, they'll go and sit in lymph nodes. Okay, that's why you will have lymph node enlargement. And in any infection also, lymph node will enlarge. Carcinoma, metastasis will happen to lymph nodes. Okay, that's why you should know all these. Very important. So here you have what is called as the thoracic duct on the left, right? And then you have the right lymphatic duct. Okay. So these are the two ducts you should know. So thoracic duct will drain the lower limbs, abdomen, left halves of thorax, head, neck, left upper limb. Right one you can see only the right half of the thorax, head, neck and right upper limb. Head, neck is coming in both actually. Both of these, head and neck. Okay. So guys, there is something that you have to understand here. You understood that there is some lymph and there is some lymph node on the way, and then finally all this drains into the via the duct into the veins. All this you understood, but you know that there is something called a central lymphoid tissue. Look at this one, guys. Central lymphoid tissue is the bone marrow and the thymus. See, you have some lymphocytes. Okay, this word you have not heard actually. Some lymphocytes, you know where they sit? They sit in your lymph nodes. These lymphocytes are made by your bone marrow, isn't it? And these in that you have B and you have B lymphocytes and T lymphocytes. See, B is both are from bone marrow only, but this T lymphocytes additionally will undergo maturation in the thymus. So these B lymphocytes actually produce antibodies. Okay, this you should know. Do you remember this diagram, guys, of hematopoiesis? Look at this. Here you have the stem cell, then here you have the myeloid progenitor. Don't look at this one. Come here to the lymphoid progenitor. This will give rise to the small lymphocyte, T lymphocyte, B lymphocyte. B lymphocyte will give the plasma cell, which actually gives you antibodies. Guys, slightly off topic here, but see, these are all your important lymph nodes. Okay, cervical lymph nodes, axillary lymph nodes, inguinal lymph nodes, etc. And all those lymphocytes, you can see they all are sitting here inside the lymph node. You can see small B lymphocytes, all these lymphocytes are here, right? B lymphocytes are here, they're saying. Where exactly is your thymus, guys? Here. And do you know how thymus looks? We'll show you. See, this is how thymus looks. Purple means, you know, you can know it is lymphoid tissue. And this is the central one. Central only two are there. Bone marrow and thymus. Otherwise, so many lymphoid tissue are there, wait. Anyways, look at this here. First of all, the B lymphocytes will give you plasma cells, will give you antibodies, right? So you need antibodies for all whenever you get any infection or something. Who is giving you the antibodies? Who is making you resistant against all those viruses? When you take a vaccine, your body will make antibodies. All that is made by B lymphocytes. Okay, this is humoral immune response because of your immunoglobulins. There is something else called a cell-mediated immunity, that is because of these T lymphocytes. Okay, so whenever you have an organ transplant, the one that will come and attack that organ is these T lymphocytes. Okay, this is all called as delayed hypersensitivity, etc. There are many types of T lymphocytes. You have the helper T cells, you have the cytotoxic T cells, suppressor T cells, memory T cells. This will remember, you know, once it gets attacked, it will remember next time when that same antigen comes. Helper T cells, CD4. See, CD4 and all is the one that gets attacked by HIV. So when HIV virus attacks a person, right, his immunity goes down. Why? Because all these CD4 count will reduce, right? So you should understand that is why, that is all the importance of this chapter we are looking at, lymphatic system. So did we again go off topic? Where are we here? Central lymphoid tissue, right? We are done with that then. Coming to the peripheral lymphoid organs, you have some peripheral ones. Peripheral are your lymph nodes, spleen and epithelial lymphoid tissues. We'll not go into that. Lymph nodes and spleen are your peripheral lymphoid organs. Okay, spleen you should know. So let's move this here. Lymph nodes part, let's move this line here. Because we said lymph node is like a trap, right? So we'll move that here. What is spleen, guys? Spleen. See here, they have shown you the location of the spleen here. You have only one spleen, okay? So what exactly is the action of spleen here? Again, they are saying some maturation happens here. Now let us go back here. We have looked at so much now. The last one is circulating pool of lymphocytes, right? So there is always lymphocytes in your blood and all. When you do blood examination, you would have seen, right? In blood, you will see lymphocytes. Basically, all these are going to be called during antigenic emergencies. You know, whenever there is tuberculosis and all, a lot of lymphocytes you will find, right? In the CSF, etc. So lymphocytes is actually indicating chronic infection kind of a thing. Look at this, guys. This is a peripheral blood smear. Here you can see lymphocytes. Can you see? This is actually leukemia. Okay, look at this. So many lymphocytes are there. ALL actually refers to acute lymphocytic leukemia, guys. It's more common in children, or in children that is common. Now we need to look at more detail in the lymph node, guys. So here you can see lymph node. You have a capsule. Then you have some lines here, which is, this is the cortex, and then you have the medullary sinus. Here you have what is called as the germinal centers. Look at this, they have labeled it as germinal center. Okay, where all the lymphocytes have grouped kind of a thing. So in the cortex, you have 3 zones, zone 1, zone 2, zone 3. And even a lymph node has blood vessels. See here, blood supply is also there. And this is efferent. So efferent, right? Lymph flow. So it's only one way, it's not a closed system, right? That's what you should know. It's entering from here, coming out of here. And this lymph node will trap all these harmful things like bacteria and all, right? In infection and all. And also in metastasis, it will enter the lymph node. Actually, something that they have not covered here is about the tonsils and all. Hold on. Those are also our lymphoid tissue, right? Those are this is actually our first line of defense. You know, when you eat something, your tonsils are waiting there to trap anything that is dangerous. Do you remember this Waldeus ring, guys? So you have the adenoid tonsil, tubal tonsil, palatine tonsil, lingual tonsil. This is actually an aggregated mass of lymphoid tissue is called as tonsils. Okay, so these actually are your first line of defense when you eat something, etc. Right? These are trying to catch those organisms. Here you can see tonsillitis. This is a tonsillar cyst. See here, they are showing you the cervical lymph nodes. See the drainage. This is your tongue, okay? So you can see how it is draining. Deep cervical nodes. Guys, just look at this, okay? Why this lymphatic thing and all is very important for breast, for cervix and all. For carcinoma, they'll know if lymph node is affected, right? They will say it is N. N0 if it is not affected. If lymph node is affected, N1, N2 like that. So this is for the staging of the cancer, right? They will use this. TNM staging is there. Where you have N is standing for the node, okay? Lymph node. T is for the tumor and M is for metastasis. So metastasis means it is going from one area to the other. So N in that TNM staging refers to node, okay? So this is cervical lymphatics, how it is draining around the aorta. And here you have the iliac, external iliac, common iliac. Around that, it is there is lymphatic drainage. Guys, there is one terminology called as lymphoma. You should understand what this is, okay? So it is involving lymph nodes. If it's mostly involving lymph nodes, you know, masses, then it's called as lymphoma. Leukemia is actually involving your blood, bone marrow, okay? Lymphoma means it will involve the lymph nodes. So in that you have Hodgkin's lymphoma and then you have non-Hodgkin's lymphoma. Basically, what exactly is the difference between these two? All that you need to know. I think it is a little too much for general anatomy. This Hodgkin is actually from B cell, okay? B lymphocyte cell, they are saying, and it will be contiguous spread. That is Hodgkin's lymphoma. It will have better prognosis. So what do you understand by this contiguous spread, guys? Means from one lymph node to the next lymph node only it will go. That is contiguous spread, okay? So that is a kind of, okay, they like that in the Hodgkin's lymphoma. So one lymph node is affected, enlarged, then another lymph node affected, then another lymph node affected. If there's contiguous spread, they think it's a better prognosis, okay? That's Hodgkin's lymphoma. There are functions of the lymphatic system now which you can say, right? Or of the lymph node you can say drainage, right? Of the tissue fluid, interstitial fluid, fat absorption. You saw from small intestine and all that, you saw that. Chyle. Then it will transport lipids and vitamins, is it? And it will also help in immune response. Okay. There are some crazy terms, you know, you should know here in lymphatic system. We'll wind up, guys. This is the last slide, don't worry. You have lymphangitis. You have lymph adenitis, then you have that lymph, adenopathy, then you have what else? So many terminologies are there for lymph. So first let us understand adenitis. Adenitis is lymph node is affected, okay. Lymph node is affected means adenitis. So if there's inflammation of the vessel, okay, or of the channels or the the network, the capillaries, lymphatic capillaries, then it is lymphangitis. Adenitis is if there is something with the lymph node, right? Adenitis actually feels like a gland kind of a thing, adeno and all that, but it is actually enlargement of one or the other lymph node, okay. Adenopathy also kind of goes with that only. I think that's enough of information, isn't it? Clinical anatomy also we have kind of covered. So now let us look at a recap. We saw what lymphatic system is. Basically, it's a drainage system, coarse type, because large particles are drained from tissue. This is in addition with the venous system of drainage that we have. Actually, this is not a closed system. It will collect all the information, collect all the fluid, etc. from the tissue, and it will drain into the vena cava, superior vena cava, you can say, okay. So basically, what else do you want to know? So this is how, this is arteriole, venule. The arteriole is coming and giving all the nutrients. Venule is collecting all the whatever the carbon dioxide, etc., and everything leaves via the venule. In addition to this, there is another larger capillaries which actually can pick up more bigger particles like proteins, etc., lipids also, is it? Yeah, vitamins and all that. So basically, this one, this is a lymphatic capillary. Here you can see it is blindly starting in the tissue. It will pick up everything. It will have an opening which will act like valve. It will take everything. Okay, so it will take the tissue fluid. And what are the components of lymphatic system? You have these lymph vessels which we just talked about. Inside it you will have this lymph which is clear and colorless. When it is taking from small intestine, it can have fat. So that's why it's called as chyle. Okay, lymph is also called as chyle there. Lymphatic capillaries, we just told you, they begin blindly in the tissue spaces, and these are not present in CNS, splenic pulp or bone marrow. This is low pressure system compared to your blood vessels, that is your artery and veins, because there is no pump here as such, and these are wider than blood capillaries because they have to pick up the coarse particles which are bigger in size. And these capillaries will drain into lymphatics, and lymphatics will drain into the duct. On the right side there is the right lymphatic duct, and the left side there is thoracic duct. Here on the way in lymphatics and all, you will meet in the between there will be lymph nodes. So these lymph nodes, what do? These lymph nodes are actually like a trap, okay, and they'll have lymphocytes, etc., germinal centers, etc. So those are actually called as they come under the peripheral lymphoid organs like the spleen, lymph node, etc. Then you have central lymphoid tissue like the bone marrow and the thymus. Actually, these are the ones which form the lymphocytes and help in maturation of them. These lymphocytes will actually go and sit in the lymph node, and there are also some circulating pool of lymphocytes. You saw in the blood and all, you'll have lymphocytes. Whenever there is an infection or anything, these lymphocytes will be delivered there. Okay, so you saw how it will help in immunity, these lymphocytes, right? You have the B lymphocytes which will give the plasma cells which will make the antibodies. You have the T lymphocytes which will give you cell mediated immunity. You will have helper T cells, you will have memory cells, you have CD4 cells which are actually attacked in HIV. The count of CD4 becomes less. That's why those people's immunity will reduce, and hence they will go into AIDS, that is acquired immunodeficiency syndrome. So lymphatic system, what and all it will help in? It will help in drainage, fat absorption, transport of vitamin and lipids, immune response also it will help. So basically, clinically, you saw importance, the edema, etc., right? Lymphangitis, lymphadenitis, filariasis, you saw, right? All this is the clinical anatomy, okay? Then you saw there is something called as lymphoma, right? Okay, so all this we have seen in this topic on general anatomy, lymphatic system, okay? That's it for now, guys. Bye-bye.